Welcome back to Wednesday Wellness with Leora. I'm thrilled to have here Dr. Randall Feingold as my co-host today. Dr. Randall Feingold is co-founder of New York Breast Reconstruction and Aesthetic Plastic Surgery. He is also one of the leading experts in en-bloc explant procedures. In this episode, we will be diving into the fascinating topic of lymphatic system. Dr. Perry Nickelston, our esteemed guest, will shed light on the importance of the lymphatic drainage and share with us some really valuable tips. We'll talk specifically about the breast implant illness community and how they can benefit from practicing this 6-point of self-massage at home while they're recovering either from breast implant or from any surgery. But first, we'll ask Dr. Randall Feingold, what are the most common autoimmune responses to breast implants?
So, well, first, thanks for having us here tonight, Leora. I think I can best answer this question by describing the kind of symptoms that my patients present. They may or may not all be autoimmune, but there is commonality in this patient population of a variety of signs and symptoms, including general fatigue, brain fog, visual disturbances, hair loss, skin rashes and skin changes, thickening of their skin and soft tissues that they refer to inflammation, joint pain, issues with digestion and food intolerances. And so there's a fair amount of commonality in these symptoms.
What would you say are the various toxins that women with breast implants are exposed to?
So when you say toxin, it makes it sound like there's like a simple substance involved. There may be toxins, but it may be a broader category of stressors that are involved upon patients. Some of it may be response to silicone, whether it's the solid elastomer of an implant shell, even if it's filled with saline. It may be the silicone gel itself, which is not a pure element. It has heavy metals in it. It has a variety of chemicals in it as well. I'm very much concerned about pathogens and their potential role. When they're attached to an implant, we call that biofilm, but a lot of my patients' capsules have embedded colonies of various bacteria, even fungus or mold. So I think there are a variety of stressors or toxins that people are exposed to that may have a role in explaining their symptoms and that we want to eliminate either through surgery or through adjunct therapies.
So in reality, following explant surgery, not all women will experience a complete healing. And that leaves many of them in a state of sometimes desperation for an answer. They're looking for a path to heal.
I do find that some patients have early responses, sometimes within days of a procedure, sometimes weeks, sometimes months. There are patients that have complete resolution of certain symptoms, some patients that have partial improvement of symptoms. I have many patients with inflammatory arthritis conditions that have had improvements, but maybe not to zero, but they reduce the number of medications they have to take or the dosages they take. So I think explant surgery is recognized as improving symptoms in many women. The FDA acknowledges it. So we're on the right path, but it's not the only answer.
Dr. Nickelston has an intriguing theory and experience with lymphatic system drainage and actually experienced relief with his own patients. So why don't we turn to you, Dr. Nickelston? It would be great if you can give us a general overview of the importance of the lymphatic system and what it is.
I'd love to. Thank you very much for having me on the show. What's interesting is every single one of the symptoms that the doctor just described can be ones that you experience when you have a dysfunctional, overwhelmed, and vulnerable lymphatic system. Okay. So it's also the job of the lymphatic system to kill everything he just mentioned. Anything that gets into your system, from bacteria to parasites to viruses to fungus, to mold, to cancer cells, and the own cellular metabolic waste that your body produces every day just from its normal regeneration, but also injuries and inflammation and issues you have in your whole body, not just where you had your procedure done. So the lymphatics is your primary waste management system of all different toxins. So that's getting stuff out that you don't want inside of you, because if they stay inside of you, your immune system will respond to that and give you inflammation. So the lymphatic system is part of your immune system. And in my opinion, it's the most important part, because what that does is those lymph nodes, they're called, and they're basically mini toilets that I say, that they take the waste in and then they break it down and they flush it out, and then your immune system reads and scans what's ever trapped by the lymph node. And that scanner cues your immune system to send out what it needs to take out that particular toxin. And each lymph node, it tries to break it down even more and more and more. So it's a scan code reader to help your body get better faster from what's inside of you. Okay, so it's primary part of your immune system. And it's an interesting fact, which we'll get to. The majority of your immune system lives in your gut, 70 to 80%, depending on the research that you read. Well, that's where most of your lymph is located. Why? Because it's a primary part of your immune system. That's why people have so many gut issues when they have symptoms all over the body. Now, another big important one that many people overlook, but to me, it's almost just as important. It's a part of your vascular system. That's the arteries and the veins. The reason being is that the lymphatic system connects into the vascular system at the veins. It dumps into the veins at the collarbone, which we're going to come back to later, but that's really, really critical for people to understand, okay? So when you have lymphatic system issues, you will have vascular issues. Now, why is the vascular system so important? Because that's the primary route where you're able to get things to your cells that are trying to heal itself through the arteries. But the veins are also a waste management route for things. Now, here's what they're finding. The veins actually play very little role in waste management. We used to think it was a lot bigger role. Now we know it's mostly lymphatics. So what you need to understand is that if the lymphatics can't get the waste out, then the lymph stays inside of you, and then it circulates everywhere. And you can feel your symptoms, your pain, your discomfort anywhere. So that's why when you work the lymphatic system, you improve circulation, which improves healing and recovery, and you improve immune system function so you can go harder, faster, stronger, longer, get back to doing what you love to do quicker. So in my viewpoint, everybody has a lymphatic system issue. They just don't know it yet. It just depends on how much and where it is.
So in terms of lymph nodes, can you just tell us how many lymph nodes are in the body, and is it layered in a certain way? Can you tell us where they're located, like the most important one?
Yeah, so they're all important, every single one of them. Now, you're going to have differences in the numbers. Some people say 400, some people say 500, up to 600 to 700. Honestly, the number is arbitrary. I want you to know it's more than one, right? And those lymph nodes gather in clusters throughout the body, right? So let's say you got 600 of those lymph node clusters, and they gather in very specific places. Now, what's interesting is I said most of your lymph lives in your gut by far. Okay? The next location for the most lymph nodes is from the collarbone up.
Wow.
That's it. So what does that mean in my world? That means that your head and your neck are really important for lymph function everywhere in the whole body. And also, why would it be designed that way? Well, that's where your brain lives. So you have to detoxify your brain and your neuroinflammation in your brain through your lymph nodes in your neck. So that's why you have blocked cervical lymph nodes. You will have neuroinflammation. I will tell you that right now. Okay. And the other place it's located majority is in the skin. So many people get skin issues because they have blocks of lymph in the other areas. So it has to bleed out through the skin. It's got nowhere else to go because the skin is considered a detoxification organ. So you need to think of lymphatics like a plumbing system, a piping system. All right. You have big pipes that go into medium pipes that go into smaller pipes. That's how it works. So the smallest pipes are at the skin. The biggest pipes are deep inside the body, in your gut and along your spine and around your organs. The medium spots, if you will, are in those clusters that we talked about before, because they reside around the primary joints of your body that are supposed to move the most. Your knees, your hips, your shoulders, your abdomen, and your upper cervical spine. Now, why would they be there? Because there's two things that move the lymphatic fluid primarily. One is movement. So the more you move, the more lymph moves. Okay. The other one is diaphragmatic breathing, breathing through your belly, your sides, and your back. Because what that does is diaphragmatic breathing increases pressure and decreases pressure. When you breathe in, pressure increases. When you breathe out, pressure decreases. What does that sound like? A pump. And that moves the fluids. So if you're blocked in the fluids in your abdomen and you're blocked in the fluids in those joints, which most people are, they just don't know it, then you have a backflow of that fluid. Now, this is really important for people to understand. The lymphatic system does not work alone. It works with all the other systems of the body. So lymph and blood flow are considered one. And the lymph is critically important because that determines the health of the environment that your cells live in, called your interstitial fluid. And your cells are only going to be as healthy as the environment that they live in. So that's why you need to work your lymphatics.
You know,
now, I would like, yeah, go ahead, Doc.
You mentioned blockages, and you talk about how arteries and veins work alongside with, lymphatics. When we think about blocked arteries, we're thinking calcium, cholesterol. Those are the things that impede flow of oxygenated blood out in the vascular system. What's causing blockages in the lymphatic system in the gut or around the joints?
Great question. So those are ones that we typically think of, but you also have to, we also get blocks from tightness and tension around the fascial structures that surround those areas. They're called neuro-lymphovascular bundles, for those that might be listening. So the nerves, arteries, veins, and lymph travel together, and they're surrounded by the connective tissue. So when those get tense and tight, and people say, well, why does that happen? Well, that's called life, L-I-F-E, from your habits and your behaviors, the way that you move or don't move, and also by pressure. So pressure in the body will change based on where you have tension or tightness in the body. And tightness and tension and pressure also change based on your autonomic nervous system. So many people are stuck in a fight or flight sympathetic dominant hypervigilant response where they tense up and then they alter their breathing. So they're a walking hot mess of muscle tension, and tight tissue doesn't accept blood flow well. So it can pool in different areas, and then slowly over time, they have a mixture of some of the things that you mentioned before, but also the fascial tension and tightness. But you also have tightness from emotions.
So it sounds like you're talking about constriction of those lymphatic vessels from the environment outside the walls of the lymphatic vessel, squeezing down on it, as opposed to substances that are building up within the actual lymphatic vessel.
But you can have both, because what happens is when you get that lymphatic, if you want to use the word stagnation, what happens is there's something I want to read, if I may. So there's a term that came out in a really great research article recently in 2021 by Brian Tuckett, and there's a condition called inflammatory interstitial stasis. So inflammatory means inflammation. Stasis means static, not moving. And interstitial is the fluid in between the cells. Okay. So what happens is this, it says this, I'm going to read it and I'm going to break it down. A normal functioning lymphatic pump mechanism, and that happens from the diaphragm, that happens from breathing, but also the pumping mechanism of the lymphatic itself is called lymphangiomes, that happens, and an unimpaired venous drainage, because remember the venous system goes in conjunction with the lymphatic system, are required for the body to remove inflammatory mediators from the extracellular environment. So that's the things that are sitting around the cell that are trying to go intracellular, inside the cell. Okay? So, but when everything goes inside the cell uses that, creates waste that goes into the extracellular fluid. So it goes back out into the interstitial fluid, and that has to go into the lymph nodes. So many people have lymph nodes that can't handle the amount of waste coming at it. It's just overload, one from neglect, but also those other factors that we mentioned, from poor movement, dysfunctional breathing, toxins being overloaded into the body. Okay? Impaired vascular perfusion, which is circulation to something. You can't get enough blood flow to something, and or lymphatic drainage, means they go together, may result in the accumulation of inflammatory substances in the interstitium. So inflammatory things are surfing around your cells that are living in that fluid. They create an environment that activates what we call nociceptors. These are sensors that look for potential underlying threat in the body, and they will send signals into the dorsal root ganglion of the spine, which will go to the brain, and that can be interpreted as pain. People get neuroinflammation and what they call central sensitization. That means that you become really hypersensitive to pain. So it's a mixture of both. It's kind of like which came first, the chicken or the egg? Yes, it's both. It's the overload of the amount of toxins going into a system that humans aren't designed to manage, plus the sheer amount of volume that it's had to deal with where the plumbing is stuck. So I equate it to, you have a toilet that's stuck because there's too much waste in it. So it can't get out. And then people keep adding stuff into the toilet and they're trying to flush the toilet, but it can't get out. So how do you unblock your toilet? Well, you got to get in there by hand and you got to move it. You got to unblock it. You got to snake it. You got to pump it. You got to do whatever you got to do to unblock it. Because if you keep flushing, it's just going to keep building up towards the rim and do what? Overflow. And that's what symptoms are. Your body's going to compensate and adapt to all this stuff until it can't. So yesterday you weren't sick and today you are. What changed? In my viewpoint, your toilet couldn't take anymore and it overflowed. So it's a mixture of both in my world. That's why we go after the actual lymph nodes that maybe or overloaded themselves, and the environment that they live in.
We talked earlier about the hydrodynamic rules of flow. You were explaining how it works. So that's so important when we'll come to talk about how to start massaging yourself. Can you explain a little bit more?
Yes, that's so critical. So it's called the Law of Hydrodynamics, and that's just the physics of fluid flow. Okay? And the basics of it is this. High pressure automatically flows towards low pressure. Why? Because there's low pressure there and energy seeks the path of least resistance. So it's important to know where the lowest pressure is in the human body for lymphatic flow and vein flow. It's where the lymph dumps into the veins. It's also where your brain dumps its waste, at the collarbone.
Yeah.
Everything in your body with lymphatics and venous flow wants to go there, at the collarbone.
So
that's supposed to be low.
So you're referring to the thoracic duct, where the lymphatic system drains into the venous system.
Yeah, subclavian vein. Yes, sir. And the duct that's there. Yeah,
Mm.
that's where it will dump into the subclavian vein, and then it'll make its way back into the circulatory system again.
Correct.
Yeah, so that's where you're supposed to have the lowest pressure, but that's where most people have blocks. One of the first signs I look for are puffiness and swelling above the clavicle. That you see it stand out, and that right there automatically tells me there's some serious backflow pressure happening in the body. Now, if that's the lowest pressure, then where would the highest pressure be in relationship to that? The furthest distance away, in your hands, in your feet, and in your brain. So that's why the feet are always so swollen. One, because of gravity, and it's got the furthest distance to travel from your foot to your collarbone. But the same for the hands. So what that means is that everything in your foot wants to go all the way up to your neck. But in order to get there, it's got to pass through other clusters of lymph nodes that might also have a blockage in there, for lack of a better term, or a pressure difference where it can't get through. So that's why you always, in my world, you clear the collarbone first, no matter what. Then when you do that, everything else automatically starts to flow in easier because you opened up the pressure. Then you work your way out. You work your way out, and then you work your way up. And we do mine through the lymph node clusters, and then we go back to do the feet, the hands, and the head. So I don't start dry brushing in the hands, and I don't start dry brushing in the feet first. I do collarbone in the clusters that we'll show you in a moment, and then we do those, because that's all based on pressure. Because if you start low and you drive that fluid up to an area that has a blockage in it, it's just going to ricochet and go straight back down because it's got nowhere else to go.
So you use the
And then
term
people
dry
stay
brushing. Dry brushing is a technique whereby you improve the flow into that thoracic duct near the clavicle.
Yes, sir. So you use different types of brushes depending on whether they're softer or harder. And then it's done typically on the skin, and you can move it in different patterns, but you ultimately want to draw that fluid toward where the fluid wants to go. Because all the fluid wants to aim ultimately towards the collarbone, but it goes to those lymph node clusters first. So, for instance,
that someone can do to themselves, or you need someone to act as a technician for you to do it properly?
It can be both. If somebody's had some significant lymphedema, they've had surgeries or scarring in a particular region, you really need to know your pressure flow routes. And I suggest you work with a trained specialist at that standpoint. If you haven't had all of that and you're just someone who's experienced some inflammation, chronic pain, autoimmune issues, then you want to take better care of the system. Then yeah, you can tiptoe in and do that one on your own, because it's just understanding the flow routes. Those prior cases, you have to go much slower on, much more gentle on, and know that, okay, if I'm blocked in this area, where's my body going to try to send it? And here's the greatest thing. When I show you how to unlock the 6 places, you unlocked every place it's trying to send it. So you clear them all at the same time.
I don't think any of us are really doing anything to maintain our lymphatic system.
Not on purpose, no.
But yet we hear a lot about health maintenance strategies that we're supposed to employ, and go to the doctor every year and check certain blood tests and change your diet and exercise a certain way or take certain medications. It sounds like lymphatic system is either not understood by many people. It's certainly not practiced by most people.
It's coming around. It's more recognized now than it ever has been before. One, because there's been an uptick in research that's beginning with lymphatics, because they're seeing a huge difference in neuroinflammation and brain health. when they're starting to tap into lymphatics, and particularly the lymphatics of the brain called the lymphatic system.
Patients asking about lymphatic massage as part of a post-operative routine for any number of surgeries I do, but in particular, the explant population that recognizes inflammation in their body. So I'm hoping you're going to teach us a little something today about these strategies and how to do them, because my patients want to learn about it, and I can't teach it to them if I don't know about it.
Absolutely. Well, I'd love to, because in my opinion, this can absolutely change your life and the course of your healing. The first step towards helping your lymphatic system is the awareness of your lymphatic system. Then you can do some things that are actually really simple that can open these areas up, because now that you understand how pressure works and flow works, you'll change how the lymphatic fluid moves, but you also change how the blood flow moves, and you'll start to get these things to process out of your body better out than staying in when you do it. And lymphatic system is the most neglected and important system in the body, in my opinion. I got into this work because it's the only thing that saved my life when I was at rock bottom and was recovering from several autoimmune diseases and some surgeries I had to go through, and significant neuroinflammation in the brain. And then that's one of the reasons why I'm so passionate about it now and teach other people that I didn't have any idea about it either, Doc, and I'm in the medical field, for goodness sakes. So I don't expect anybody else to know about it. And then it's just a matter of doing the techniques, which we'll be happy to show you.
Yes. So I think it's the right time to jump into what you have developed. It's called the Big Six and self-care lymphatic drainage massage. And let's do it. I'm so excited. I'm ready.
Yes. Me too. Thank you very much for giving me the opportunity to share this. So this Big Six is all based on what I told you before about how pressure works, right? So we know the lowest pressure is at the collarbone, and we go and pay attention to where all the clusters sit, the big clusters, because that's where what I call the muck, the stuff that's in the milieu that you want to get out in the toilets. And it's also going to stimulate the pipes that run next to it. Arteries, veins, and nerves, because they all work together. All right. So we always start at the collarbone. Right? Oh, but let me preface this first. Okay. Let me explain something. You need to make sure that you're well hydrated when you start to do lymphatic work, because the lymphatics are 90% water, and your blood is a majority of water too. Most humans are dehydrated. And that dehydration will make you more likely to experience what we call a detoxification reaction, which means that you will feel pretty bad when you do lymphatic work. If you're not hydrated, you might feel pretty bad even when you are hydrated, because you're starting to move things that have been stuck in you for a long period of time that need to get out, and then your immune system's going to be kicked in. But the good thing is, with the Big Six, it won't be too much for you. Okay. So make sure you're hydrated. And the other one is make sure you're not constipated. Okay. Because going with bowel movements is called phase 3 detoxification. That's where you're going to poop out all the bad stuff. So if you're blocked up with your bowels, all that stuff going to head there and can't get out. And you're not going to, trust me, you are not going to feel well. Right? So you do whatever you got to do to move the bowels. Now, if you're dehydrated, you're probably constipated, because dehydration causes constipation. But when you work the lymphatics, sometimes that's enough to keep these things going. You guys got that? So I want to anticipate that when you do the Big Six, this seems really simple. That's because it is. It almost seems a little silly because of how simple it is. But I want you to understand the physiology behind it, but what we've been talking about for the last half hour. Okay. You might feel worse before you feel better. So don't let that make you nervous. Okay. Right. So spot number one, you're going to be below and above the collarbone. So we start on the left side first, because the majority of the lymph in the body goes to the left-hand side of the collarbone. About 75% of all the lymph goes here. That's why it's most often blocked. So what I want you to do is take your hand, and I want you to put your fingers underneath the collarbone. And I want you to just lightly massage underneath the collarbone in circles. Go clockwise and go counterclockwise. Don't press so hard that you cause pain, because when you cause pain, you tighten up, okay? Then you can actually rub in different directions, side to side, up and down. And I want you to do some light tapping in there. Now, this is the one that I tell people to push a little bit harder on, because underneath your collarbone, there's a muscle called your subclavius. So that controls how your collarbone moves and your first rib moves. If that is tight, it's going to clamp those two down, and you're going to lock down your fluid flow. So stick some fingers underneath the collarbone and scrape a little bit. If it's tender, that means you need it. Okay. Yeah. Do the same thing on the other side. Go underneath the collarbone on the other side and notice the difference. Does one side feel different than the other in relationship to tightness or tension? If somebody's had surgical procedures around the axilla, the pectoral, or the sternum, this area is going to be a hot mess. Okay, there's going to be an issue here. Then go back and forth and then press up underneath a little bit, and you do a little bit of tapping. Now, there's no magical amount of repetitions or magical amount of time. That's going to vary. The most important thing I want you to take away from this is that's where you start first. Now you go above the collarbone. Same thing. So in that space above the collarbone, next to your neck, but in front of your trapezius muscle, there's this little divot here. Rub there. Put your fingers there and go clockwise and go counterclockwise. Then rub back and forth in all different directions. Okay, give a little bit of slight tapping there. And then just rub down towards the collarbone, because we're helping it flow to where it wants to go. Now do the same thing on the other side. This is spot number 1 in Big 6. You always start here. And then relax. Now, number 2 is at the top of the neck, on the side of the neck, behind the angle of the jaw, right below the lobe of the ear, where the largest lymph node in the neck sits. So this is a major drain point from anything up. Now that sits next to the primary blood flow going into your head and out of your head, and your vagus nerve sits there too. So here's a double win bonus, everybody. When you rub spot 1 and you rub spot 2, you also stimulated your vagus nerve. Okay. So now you can do both sides at the same time if you want here. Feel, is it puffy, tender, or swollen? And I want you to do circles, clockwise and counterclockwise. And I want you to go up and down, and then go back and forth. Do some light tapping there. And then now I want you to put your hands on 2 and stroke down to 1. Do that a couple times. Because now 2 automatically wants to go to 1 because you opened up 1. You follow? Does that make sense?
Yeah.
Okay. So spot number 3 is a common area where people get blocked because of tightness or tension in the pectoral region, and it will be for your type of client because you had to go in here. That's the pectoral/axillary region. It's right in front of where the shoulder joint sits. So what I want you to do is take your entire hand, and I want you to go over the pec and under the pec near the axilla. Okay, rub in that region and then do circles. Do clockwise, do counterclockwise. Okay. And then you can lightly tap, and then you can pull up from there towards the collarbone because that's where it wants to go. Now, many people who've had a procedure here, if that's blocked, your lymph system is going to want to send it to your opposite side shoulder. Okay, so you always have to clear both sides. So now go in that pectoral/axillary region, use your whole hand and do circles, clockwise, counterclockwise, back and forth. Just don't cause pain. Do some light tapping, and then you can stroke up towards the collarbone. Okay? So that's really important.
I feel like I have a tender area there under my pec major. Perhaps it's between pec major and pec minor. I don't know if that's, the lymph node basin there that's actually sensitive, or what that says about the condition of my lymphatic system there. But it's a little bit tender there.
Yeah, it could be. A lot of times when in that region, people are going to have tightness or tension because of the pec minor and pec major that are really tight and restricted all day. So that may be your lymph in that region, but everything is going to get tense and tight in there. And then that's the area that becomes compromised. So now the shoulders will go and flow towards each other. And I'm going to give you an extra, I want to give you a 7 tonight because I'm going to give you an extra bonus one, right? So that's spot number 3. Now, spot number 4 is the abdomen. Pretty much the most important area that I work on. And the abdomen, I'm going to be from the bottom of the sternum at the top of the abdomen, all the way down towards the navel in that region, including the navel. So what I want you to do is I want you to start to rub in that region. Right? I'm going to stand up a little bit so maybe if they're watching, they can see me. You can do, for time's sake, I'll show you both hands. You just put your hands on your abdomen, one on your belly and one above. And what I want you to start to do is just rub that belly. And I want you to go in circles, clockwise, counterclockwise. Okay? You can actually rub up and down. You can rub side to side. Okay? You can actually do some light tapping in that region as well. And when you feel more comfortable, you can actually take your fingers and work in much deeper in the abdomen down towards the navel. That's where you'll typically find the majority of your blockages. Why? Because down there is the largest lymph node in the body called the cisterna chyli. It sits halfway between your navel and the bottom of your sternum. That takes all the lymphatic flow from everything in the lower extremity and your organs, particularly your liver. So your liver dumps 50% of the lymphatics in your body is produced in the liver, and it goes to that spot. And from there, it goes up the big pipe along your spine and behind your sternum to go to the left side of your neck, the left collarbone. So if you're blocked in the abdomen, you will have a backflow pressure all the way up to your head. So what I'll contend is you won't drain in your axilla and your neck because you have the blockage below, because pressure goes both ways. You follow? So I know how bad a detox is going to be on somebody based on how tender, puffy, or swollen or painful it is in the abdomen. Sometimes it's so painful you can barely touch it. That's telling me there's a lot of blockages there. Okay? So that's spot number 4. Spot number 5 is the crease of the groin along the inguinal region, like when you sit down and you have the crease of your pants. So you do the same thing there. I'm going to stand up. You just take your hands, we'll do both at the same time. You can rub in circles, clockwise, counterclockwise. I tell people you can do figure eights. I mean, I jokingly say you can make hieroglyphics. I don't care what you do here because tissue moves in all different directions. Then you can rub up and down and side to side and do some light tapping in here. Now we want to clear down below because if you're blocked in the shoulder, the body will try to send it to the opposite shoulder and it'll actually send it down to the hip in what's called a watershed. That's how fluid moves. It's going to find its way out somewhere as best it can. So that's why we always release the 6 always together, because now I know no matter where I go, I'm opening up a valve. I'm opening up a pipe. So you rub the groin. Now, spot number 6 is behind the knee. So the crease behind the knee that's bent all day long because people sit all day. Imagine the position when you're sitting. Every single one of those valves is choked. Now you rub behind the crease of the knee. Same directions, clockwise, counterclockwise, up and down, side to side, and you do a little bit of tapping. So now that you opened up those big clusters, now in my world, you can go back and you can brush from the feet up, you can brush from the hand up, you can brush from the brain down because I opened up the drains. Now everything can just go yippee and go all the way through up. Now I'm going to give you a number 7 here that's really important. It's along the sternum. So if you feel along the center of the sternum here, Okay. Doc, when you do your procedures, do you have any incisions along the sternum, or you do mostly on the outside or underneath?
So we don't like incisions in the sternal area because they don't heal particularly well. They
Okay.
can be unsightly or develop like a thick hypertrophic nature. You might see that in someone who's had open heart surgery, for example. So we try to hide our incisions in the crease under the breast, sometimes around the perimeter, around the areolar, outside the nipple. But we try to avoid the sternum.
Okay, perfect. That's what I wanted to know. What you'll find is when you have issues in the axillary region and the thoracic trunk that runs behind the sternum along the spine, you'll get a lot of puffiness and swelling on the sternum that can be excruciatingly painful. That means it's backed up lymph in my world. So I have people rub along the sternum. You'll typically feel it right in the center mass of the sternum. And the last part that you'll do is where the ribs attach to the sternum, in between the rib spaces along the sternum, you want to rub there too, because in between each rib, you're going to have nerve, artery, lymph, and vein that get blocked there. And then those can be really, really tender, but significantly blocked. People don't realize how painful that area is until they touch it. That's where a lot of those toxins gather in those endpoints. So that's an extra number 6 bonus that I have people do. Then after that, what I have you do is breathe through your nose, close your mouth because you'll move your diaphragm more. And then if you can, if you don't have pain, you'll stand up and you'll lightly mini bounce up and down on the balls of your feet with your heels leave the ground like you're trying to do a calf raise really, really fast. That's called rebounding. Okay. Yeah. You have built-in rebounders. They're called calves. And those are designed to pump the venous flow and the lymphatic flow from the lower body up to where? Your collarbone. Right? So people ask me about rebounding all the time. Yes, jumping up and down will move lymph. But what I have people do is this. If you have significant blockages in those lymphatic big 6 regions or in your abdomen and you jump up on a trampoline, most often what will happen is you're just going to stir up the waist and it can't get out and you're going to feel worse because you have to unblock the drain first. That's like sticking my hand in the toilet and swirling it around because it's not clear. So you do the big 6 first, then you jump up and down.
Okay.
You will have a significantly different result because you opened up pressure valves. That makes sense.
Yes.
And you don't have to jump up and down a lot either. You know, more isn't better, better is better.
If
and then see how you feel.
If a patient of mine goes for lymphatic massage after surgery, are they treating the patient in this systematic manner, going from 1, 2, 3, 4, 5, 6, or is there something more generic that they're doing? Because I don't know that everybody is following your program.
They don't. There's many different ways that people work lymphatics depending on how you were trained. They'll follow typical drainage patterns. Very often, depending on where the training was, they isolate regions where they have lymphedema or the swelling and inflammation. So they'll start there and move it in towards, because everybody should know where the drain point is. Right? I don't do that in my world because here's what I know: your body is one piece, and you can't separate lymphatic pressure. So you have to get the whole system. So what I do is I open up the 6, then I go back and I isolate where your area is and move it. So I've had people go to 10 different lymphatic specialists. They get 10 different things done. Not all the same. Not all the same. That's where you might run into issues because it's hard to find one that really knows it.
It is. It is. Can you tell us any specific story of healing of your patient, like certain condition, just by working on the lymphatic system?
Oh my goodness, I have so many of those. Well, one is myself.
Well, why don't you
I'm
share the
patient
story?
zero.
Yes, share your story with us.
Yeah, well, I do see a lot of people in my world, not so much for lymphedema. I see people who have other issues, chronic pain, autoimmune disease, chronic disease. They're the people that they have all the blood work done and they have all the tests done and nobody's finding anything and they can't get out of bed. Right.
Hmm.
So I know there's something going on in there. So then we look at the lymphatic system. I've had a huge amount of people that see me who have gut issues, like leaky gut, Crohn's disease, because they found a nice research article that the lymphatics will be a significant cause of Crohn's disease, backed up lymphatics. Well, that makes a whole heap of common sense to me because that's where most of your lymph lives, right? But I see a lot of people with neuroinflammation, brain fog. Brain fog is probably one of the most common signs of a dysfunctional lymphatic vascular system, as well as inflammation in the body, chronic inflammation. And autoimmune disease is inflammation gone awry.
Yes.
It's everywhere. So, well, then I'm going to ask you, what's the number one system to handle inflammation? Well, it's the lymph. So if you want to drain the brain, okay. Now, what's really cool is they recently found a brand new meningeal layer on the brain. They used to have only 3. Now they found a 4th one. And it's a lymphoid-like brain layer. Imagine that. So it's been there the whole time. We just couldn't see it because we didn't have the technology. That helps the toxins drain from the brain. So what we do is we do the lymphatic bigs. I had somebody come in to see me the other day who had significant brain fog and neuroinflammation. And then I check their system. I do a lymphatic system check. I check the big 6 regions. Every single one of them was just as painful as the last one. Really puffy and tender in the sternum. And I could barely go near the abdomen without her recoiling off the table and really wanted to punch me square in the face because it hurts. It's not supposed to hurt like that anywhere on the body. And so I knew that I have to begin to clear the peripheral lymphatics before I did the brain because of pressure. If you're that blocked below, you're going to be blocked at the collarbone where the brain drains. And we know that the peripheral lymphatic immune system will influence the central nervous system and the brain. So then I'll do the big 6, and I dedicated more time to working the what's called the deep cervical lymph nodes. Cervical means neck, nodes in the neck. Deep means exactly that, deep. You will not get those from dry brushing.
Absolutely.
You have to get your hands in there, and you got to run your hands straight along the spine, and you'll find them. And they're going to stick out like BBs or small peas when they're backed up. And that's important because that's where the cerebral waste drains. And once the brain cleans itself out at night when you sleep, if you sleep, is where it goes. And it also goes out through the meningeal lymphatics, through your dural system, through the veins. But guess what? If you're blocked at the collarbone, you're also blocking what? The veins. So they can't get out either. And if you block stuff going out, you're not going to be able to get stuff in either. So then you compromise what your brain needs to function, which is blood flow. Yeah. Your brain is one of the most metabolic structures in the body because it makes a lot of waste. So your neurons poop every day when you use them. And they got to get out. So all I did was open up her drains, open up her toilets. And I see it all the time. And it happened for me because I was headlong into Alzheimer's type symptoms for me, where I couldn't remember my kids' names. I couldn't practice. I couldn't teach. I was sleeping 15 hours a day and feeling always tired, fatigued, and lethargic. And I went through the stuff that I do now, right? And then just within one session, you notice a significant difference on puffiness or swelling in the body. And a lot of people will lose a good amount of weight because you get rid of toxins and water retention and fat that surrounds toxins. And then you start to get your brain back.
Did you bring in an assistant to do those massages to you to help clear the lymphatics, or did you do it to yourself?
Do myself. So the beautiful thing about my techniques is 99.9% of them you can do them to yourself as long as you know where to put your fingers. So everybody can do the big six to themselves. Everybody can do the abdomen to themselves. Everybody can do the stroking things to themselves. Same thing with the working in that deep part of the neck. So for me, did it to myself. And then I teach people that come in to see me how to take care of themselves and do things on a regular, because you should do, in a perfect world, the big six every single day of your life, assuming if you don't have a detoxification reaction, because you need to give your body a chance to recuperate. You're always going to have stuff coming in. You're always going to have metabolic cellular waste just from your body living on this earth all the time. And your tortoise are going to get backed up. So if you can stay on top of it, that's great. So here's the thing. Everybody's always moving lymph all the time because everything you do moves it. If I touch it, if I move, if I breathe even the wrong way, or I get a massage, you're moving lymph. But here's the difference. You have to do it in a strategic order in order to move it the most efficient way. So you're not just stirring up the toilet. That makes sense. When you do that, then stuff starts to move. So I want people to have a purpose, and I want them to have an intention when they do it. With my technique, clear the big six first, and then rub everywhere else. And then go back and spend a lot of time on the area that's real. So let's say, for instance, somebody has severe lymphedema in a right leg. I'm not going to start in the right leg. That's what I'm not doing. Where am I going to start based on what I said today? The collarbone. And then I'm going to work the big six. And then I'm really going to work the abdomen because the leg drains to the abdomen. Once I do that, then I'm going to go back and I can spend an hour on the leg because the valves have been damaged in that region. So you have to go easier and you have to go slower. But I have to clear the pressure higher up because if I don't, the pressure is going to stay down there on the valves. Does that make sense?
It does.
No, it does. And I like that approach because it's anatomically sound. You need to do it in that order. Otherwise, you're not going to get things flowing. I have patients that ask me if it's okay to start going for lymphatic massage treatments. And if they're not too tender in their surgical sites, I'll say sure. But I really don't know if they're all getting the same type of approach, if it's systematic or anatomically based. So I think I'm going to have to learn more about who these practitioners are and whether they're following, your kind of sensible pathway approach.
Yeah, plus the more that clients are educated on their own and understanding how the system works, now that you know where the pressure points are and how the drains work. And it's just communicating and talking with somebody who's going to do your lymphatic massage and work in that region. Also, many people may do a lot of lymphatic work, but you want to try to find somebody who specializes in post-surgical lymphatic work. They get a little bit of extra training in there, and that's just a matter of asking them when they do it. There's many different techniques out there for lymph massage. Probably the most popular one would be a Vodder, Vodder, which I like that technique a lot. He's considered kind of the pioneer in lymphatic drainage work. They're very good at what they do. My system is adapted where it's a mixture of, I've taken many different things from different disciplines, knowing anatomy and physiology, and I study a lot of classical osteopathic medicine. So many of these techniques I bring in to the lymphatics because I know there's more going on when I work a place than just lymphatics. So when you hybrid those together.
Do you treat individuals in a clinic of your own?
Yeah, I have an office in Saddle River, New Jersey, just outside of New York City. And people come in to see me for the hands-on treatment there. I do all of it myself. And then I also offer courses where I teach self-care techniques, but I also teach clinicians how they can work with individuals. But see, the thing with my work is it's designed to mix in with all the other types of different therapies and modalities and treatments that people are doing, because I'm just trying to open up the fluid flow routes in your body so your cells in your body can do what they're designed to do, heal themselves. Because I will contend, based on what I've seen through experience, what I know through physiology, is that if fluids don't move well, you will struggle to get well.
Absolutely.
When you teach individuals for self-help, do you do that as remote online teaching? How do you reach the population?
That's mainly what I do now. For 5 years, I traveled all over the world teaching my techniques, but then the zombie apocalypse hit, right? And then everybody had to change what they're doing. Then I went to an online webcast format that I do now. So I have two different ways. I launched a self-care video that's been out for a while called Body Aquarium Lymph Mojo that people can watch and get the basics and fundamentals of self-care on their own. And then I have a 2-day intensive, like I'm going to melt your brain kind of course, 2 days. So there's many different ways that people can choose to learn with whatever might be best for their learning style. I just tried to get this information out to the world because I saw that the world needs it, because people are suffering so much and still struggling and not having answers on why they can't get better from what they're doing, even though they're doing what they're supposed to do or what's supposed to work, but they still hit a wall and they don't know why. What I'm saying is this: I don't know if the lymphatic system is going to be the primary cause of your issue. I have to check it to rule it out and at least remove it as a player. Because if it's not a player, that's great. I don't have to worry about it, that I can move on to something else. But I will stand by this until I'm dead. If you have a lymphatic system problem and you don't address it, you're always going to struggle.
So in fact, I've been watching your videos for a while now, and I was really impressed how you've been sharing your information. And it's so clear that your mission is to empower people just by teaching them self-care strategies for lymphatic drainage, because until now, Dr. Feingold somehow said the same, that women are not sure about what they're supposed to get in that massage. And it's not very clear what works, what doesn't work. So I'm so thankful to you for sharing with us this valuable information. And I'm sure that we'll share it with the community. And I really feel like I want to do another podcast. I'm so excited about what we can achieve here.
Well, yeah, listen, I mean, I love lymph. I can keep going for days because I love this system so much. I just tried to give you the fundamentals and the basics.
Perry, I've learned a lot from you. I think you're an effective communicator and teacher. It makes sense to me. And I think I'm going to be able to take care of my patients a little bit better because of the knowledge you're sharing with us. So I thank you.
Thank you, doctor. I'm very blessed, very grateful.
Thank you to both of you. And I'm so excited to continue this kind of line and of self-care. And thank you so much. And good night, everybody. Thank you.